Hello, everyone. Good afternoon. Amazing. Well, we will go ahead and get started. Hello, everyone, and I'm thrilled to welcome you all to today's webinar, State Strategies for Respite and Workforce Registries. I'm Kimberly Hodges, a Senior Policy Associate here at the National Academy for State Health Policy, and I will moderate our time here together today. And Claire, oh, perfect. Thank you. Next slide, please. So we also wanted to first thank our funders for their support of NASHB's work in respite care and family caregiving writ large, including today's webinar. They are the Administration for Community Living and the John A. Hartford Foundation, and this webinar and some of the work detailed here today truly would not be possible without their support. Next slide, please. So to help frame our discussion today, just a quick overview of the agenda. We are so fortunate that we will first hear introductory remarks from uh, Emily Anoze. She is an Aging Service Program Specialist at the Administration for Community Living. We will then hear from Lisa Snyder. She's the Executive Director at the Respite Care Association of Wisconsin, who will really set the big picture and provide context of the National Respite Care Provider Training, also known as the NRCPT, and also the importance of the importance of registries. We will then hear from Dr. Kezia Scales, Vice President of Research and Evaluation at PHI, who will showcase recent PHI research on registries and consideration for its design and use. And then lastly, we love to hear from the states. So we have B. Rector, Assistant Secretary at the Washington State Department of Social and Health Services, and Nancy Nicholas Meyer, who's a director at the North Dakota's Health and Human Services. And so these two states, Washington and North Dakota, will really get to hear their experience of working with a registry, including its design, development, financing, and outcomes. Next slide, please. And then I just need to cover a few webinar logistics, but before we hear from my colleagues, we have allotted some time for questions at the end of the webinar. You can send those questions in via the Q&A feature, but you don't have to wait until the end of the presentations. Feel free to, as a question comes to mind, submit that in the Q&A box. And additionally, to access closed captioning, please select the button at the bottom of your screen. And lastly, the slides and webinar recording will be posted on the NASHB website, and we will make sure to send that out to you all. And so with that, I will kick it over to the Administration for Community Living, Emily.
Thank you, Kimberly. Good afternoon, and thank you for joining today's webinar, State Strategies for Respite and Direct Care Workforce Registries. I'd like to thank the National Academy for State Health Policy, NASHB, and the John A. Hartford Foundation for developing and hosting today's session, and to all of our speakers and participants for making time for this important conversation. NASHB plays a vital role in supporting state policymakers and advancing strategies that better support caregivers nationwide. This work directly aligns with the national strategy to support family caregivers. Their interdisciplinary work across aging and disability, behavioral health, palliative care, long-term care, and reentry helps states develop innovative policies and practical solutions. Through tools like state trackers, technical assistance, webinars, blogs, newsletters, reports, national learning collaboratives, and partnerships with key stakeholders, NASHB ensures that states are equipped to strengthen systems of care. I've had the opportunity to see the impact of this work firsthand, and we're grateful for their partnership. I bring greetings today from the Administration for Community Living, ACL, on behalf of Mary Lazare, Principal Deputy Administrator, serving as the senior official performing the duties of the ACL Administrator and Assistant Secretary for Aging, Carrie Benson, Deputy Assistant Secretary for Aging, and Alice Kelsey, Deputy Director. My name is Emily Anozier, and I'm a gerontologist with the Administration on Aging. I'm also the Federal Program Officer overseeing the Lifespan Respite Care Program. Through this program, ACL supports the advancing recruitment, training, and retention of respite care providers special projects, also known as the National Respite Care Provider Training, or NRCPT. It is truly an honor to open today's discussion and to recognize the important work states and community partners are doing to expand access to respite for family caregivers. We're really excited about today's lineup. This work builds on earlier efforts focused on workforce recruitment and training and advances a national competency-based approach to strengthening the direct care workforce. Partners in this effort have included NASHP, PHI, Ujima United, the Arch National Respite Network and Resource Center, and the Respite Care Association of Wisconsin. During the first phase of this project, partners field tested a competency-based online training for entry-level respite providers across 10 pilot sites. This work informed the National Respite Care Provider Training and Replication Toolkit, which is available today and it is free, and states and community-based organizations can use to implement or even adapt evidence-based training grounded in core competencies. Today's webinar takes place amid a national direct care workforce crisis. Direct care workers, such as home health aides and personal care assistants, provide essential support that allows older adults and people with disabilities to live independently and gives family caregivers the opportunity to rest and recharge. Yet, this workforce continues to face challenges, including low wages, limited health benefits, understaffing issues, training discrepancies or lack of, outdated registries, a lack of information or an easy way to find a respite provider, and few career pathways, just to name a few of the barriers. Demand far exceeds supply, and these challenges are only growing. ACL has made significant investments to address these challenges. The current NRCPT project builds on years of state planning, pilot testing, and evaluation. States are expanding access to free training, strengthening provider registries, and improving how families connect with qualified respite providers. Preliminary data from Lifespan Respite Care Program state grantees shows a percentage increase in caregivers served, respite being provided, and training being delivered, all an encouraging sign of progress. Today's discussion, like Kimberly said, will focus on the importance of respite provider training, respite workforce registries, research findings and implications and insights, and highlight practical state strategies and examples to help move this work forward. Thank you for joining us. I hope everyone is staying warm in the snow. And with that, let's go ahead and begin today's discussion. It is my pleasure and my honor to introduce the first speaker, reintroduce Lisa Schneider, the Project Director for the ACL federally funded Special Project Grant and also Executive Director for the Respite Care Association of Wisconsin. Over to you, Lisa. Thank you.
Great. Thanks, Emily. I am going to provide you with a little bit of background as to how we got where we are today, because it was a very plotted, planned, and carried out process that we went through to help bring you more evidence-informed information in your decision-making process of implementing the NRCPT and registries. So I'm going to talk to you a bit about the National Respite Care Provider Training and the pilot project that came to be. And then what we discovered through that pilot is the importance of having registries. I'm going to a little preview of what we use here in Wisconsin for our respite registry, and then to also highlight one of the key findings that we have identified as barriers or some legal considerations. So next slide. I did want to say a bit about the National Respite Care Provider Toolkit that Emily referred to. This is something that has 5 key components to it. There's an executive summary, assessing readiness, course content, which is already available and downloadable to just use the free training already, marketing and recruitment and evaluation of the pilot project. But we will be adding a component that is going to be dedicated specifically to the registry consideration, things we've learned since the pilot project to share with you today, and then which will be implemented in the toolkit hopefully very soon. So we're going to talk about the training a little bit in the pilot project that we did, where we did develop a core set of common curriculum. So we wanted to have a uniform standard that would get implemented at the state level so that we were training people in a more consistent manner. So we developed this curriculum. It was a very arduous process, but we boiled it down to 10 sets of core competencies that now make up the 10 course modules that we have that people can take and complete. We piloted the project in 10 different states. We had a great geographic representation, as you can see on the map right now. And we piloted this for a year. So it took a year to basically develop and implement, a year to do the pilot project, and then a year to do the evaluation and assessment of the project. So with that, we documented our successes and lessons learned all in the NRCPT toolkit. Next slide. So one of the key lessons that we learned was the importance of having a registry. One of the one-year pilot was successfully engaged with participants, and we increased the number of learners that completed the training, but the outcomes that were strongest in states were ones that had a registry to connect family caregivers with the trained workers. For those who did not have that connection piece, learners really started dropping off once they learned that once they complete the training, what's next? And although they can do some marketing on their own, the whole intention was to create a pool of trained respite care workers that family caregivers could search for, identify learners that meet the criteria of their needs in their community. So with that, we decided to do a little bit more deeper dive on registries and what components are key, critical, what ones people are using. And Casey will definitely go much more deeper into those components, as well as other states sharing how they're doing with their registry connection tool. Next slide. So Wisconsin's registry, we've had it since 2013. So we were one of the first ones to develop a respite registry, in addition to having the respite care provider training. So it was just the RCPT that we implemented about 2013. And it was the basis of that RCPT that became morphed and became the NRCPT. So our registry was really basic for the most part, and it still continues to be. We're in the process of right now switching over platforms, and so we're going to make it much more comprehensive in what information is contained and the search criteria that we'll be having. But right now, we currently have our registry. It's interesting because we're in the process of doing a website makeover because it's out of date and we're having to redevelop it. So the way it looks right now is not how it will look in the end. But the snapshot will still at least provide you with what we have right now. So what was really important for us is that, we cover all the 72 counties and 11 tribes within Wisconsin. And we also try to house only those that are providing in-home respite care or independent providers and agencies that are facility-based or provide home and community-based services care. We ask providers to identify what areas they really want to focus on. Do they want to focus on providing cares for children, adults, older adults, and if they are working independently or if they are working for an agency. Um, so a family caregiver can go on there and plug in, like if it were for me, I would want to be doing a search by county. So for, well, actually this example, we're doing a search for Washington County. We're looking for in-home respite for children, and we conduct the search. And next slide. It will populate a list of people that meet that criteria based on your search that you wanted to perform. This is just one example of a registry profile that we have on there. And I thought it was interesting. The first one that I found was a man providing respite care with very comprehensive experience. And I just thought, wow, we don't get these very often. So I'm gonna showcase this guy. Um, so you have the registry profile there, so somebody can take a look at it to see. They've got open availability. Sometimes people are, more limited in I'm only available on weekends, I'm only available, in the evenings, or, but they provide their specificity. So when I'm looking at this to see if somebody's going to meet my needs, I'm going to look at all of this criteria. And then if it ends up being something that I think, hey, I'm interested in this person, that as you can see, we don't, I would email that person and reach out to them and to say, hey, I found your profile. I think that you'd be a great care provider for my daughter and a respite provider for me. And then just get to talking. And then we would establish our own rapport about whether or not to move forward with the relationship or the match or connection. But the relationship is between the family caregiver and the worker. Our CAW is not, I'll talk a little bit about that in the next page, but the relationship happens between the family caregiver and the registrant. And really, we're just providing a tool for that connection to happen. That's the importance of the registries. Next slide. However, during the pilot project, we did run into some pretty significant concerns with some in regards to legal considerations. And actually, one of the pilot states had to pull out from the very beginning because their legal department had some concerns, and they weren't able to mitigate them in time to participate in the pilot project. So with the 10 states that we did have, we were all able to get through this process and do the pilot project. But the key legal considerations that were really big issues were understanding that the registry is a community service, and it is not at least for Wisconsin, the registry is a community service and not a complete or verified list of providers. So we don't do background checks, and we don't verify, because a lot of the times that is where your greatest risk comes into play, because you're making that determination. So we do support family caregivers to conduct a background check. We provide them with information on how to hire and train your respite care worker, as well as providing information to the provider on how to interview the family caregiver and learn information to know about the care recipient and the care that they require. And again, it's for informational purposes only, our registry. There was no employment or affiliation related between the worker that completed the training being listed on a registry. Again, it's just a tool, it's a community service, but it does not imply any employee-employer relationship. And that's really a key thing, because every now and then we will get a workers' comp claim or unemployment claim, and we send back, they were never employed with us, and so it literally goes away at that point. So we've never had any issues in regards to employment-related issues in all the years that we've been doing this. But we do probably kill people on acknowledgements, terms and conditions, and just making sure that they understand the purpose and intention of our registry. So we do have a lot of information on holding harmless and indemnification that providers agree to protect our CAW from any claims, costs, or damages related to the use of our registry. We also have, or any of the services provided. So the caregiver has to acknowledge things when they become when they use the registry. The same thing happens for people who are listed on the registry. So they're all agreeing to various terms and conditions and hold harmless clauses and stuff like that. RCAW does hold the right to refuse or remove any listings that end up being deemed by RCAW as inappropriate or not fitting the purpose and intent of the registry. And I think we've not had any issue because one we looked into, but it never amounted to anything. So we've never had an issue in regards to that. We're also clear on that there's no endorsement by being listed on a registry or not being listed on a registry. It's just a conduit. We're not responsible for any of the outcomes in regards to the services provided. So again, these are all information in terms and conditions that we have people indicate that they understand, have read, and agree to them before they can use both our training and our registry from being listed as a provider and searching it from a family caregiver perspective. So with that, here comes the fun stuff now. Kezia is going to do some great digging deep dives into some registries and research that they found. So Kezia, handing it off to you.
Great. Thank you, Lisa, and thank you, NASHP and ACL for hosting and supporting this webinar, and thank all of you for attending. Again, my name is Kezia Scales, and I'm the Vice President of Research and Evaluation for PHI, and I'll be sharing findings from our work exploring and cataloging matching service and respite care registries. Real briefly to introduce PHI, if you're not familiar with us, we are a national organization that is dedicated to promoting quality jobs for direct care workers as the foundation of quality care for older adults and people with disabilities and serious illness across settings, primarily long-term services and long-term services and supports, and of course, respite care as well. On the next slide, whenever possible, I like to start a presentation about direct care workers or proximal topics by making space to hear from a direct care worker directly. So this is John Poland, who works as an independent provider in Washington's consumer direction system. And in this quote, John says, "Once I officially became an independent provider, I got access to resources and trainings I wish I had when I first cared for my grandfather. This work is rewarding in its own right, and I like being able to support individuals' needs and help them do things. But caring for someone as your job is a lot more demanding than people think." And I just wanted to share that quote because although he's not speaking about registries specifically, registries are one of the resources that can help mitigate those demands of professional caregiving by ensuring that paid caregivers can find the hours and the schedules that they need to stay in this field, as well as ensuring that consumers and family members can access the support that they need. So next slide, please. I'd like to give a bit of an overview of the topic of registries, kind of zoom out, building on Lisa's presentation. And then I'll share more specifically how PHI has studied this topic and what we've learned so far. So on the next slide, first of all, the zooming out part, what do we mean when we talk about a registry? And it's important to just take a moment to be clear in any given conversation, because actually there's no single concept of a registry or even really an agreed taxonomy of different registry types. So these are some of the terms and concepts in the mix: employment platforms or job matching platforms, workforce or worker or training registries, matching service registries, respite care registries. Across these different terms and concepts, though, these are the key potential registry functions that I would like to elevate. They can be used as a centralized record of training and certification. So the CNA registries that every state has in place are an example of that. They can have a more proactive and extensive matching function, enabling potential employers to post jobs and/or qualified providers to post profiles. More broadly still, they can help strengthen workforce recruitment, training, and retention, and help overcome caregiving gaps and unmet needs. And in various ways as well, sort of as a secondary benefit, these platforms can facilitate engagement and communication with workers and or clients that may otherwise be quite hard to reach, and even facilitate data collection about these critical populations. So on the next slide, real quickly, I just wanted to point to this informational bulletin that was released by the Center for Medicaid and CHIP Services, which provides useful information about the different functions and potential value of direct care workforce registries and how to finance them. So I'd encourage you to check it out. And I put a QR code here to take you to the resource. I do want to acknowledge that it's a couple of years old now. It was released in 2023. So of course, it's important to see if any of the specific guidelines or requirements have changed. So on the next slide, with that broad overview, I would like to delve into PHI's research on this topic. For more than a decade, we have been tracking at PHI what we have called matching service registries, which are the type of registries that serve to connect self-directing consumers with potential workers and vice versa. And we've shared those findings through a dedicated page on our website. Then more recently, we were so fortunate to join the Respite Care Association of Wisconsin as a sub-awardee on their ACL Lifespan Respite Special Projects grant. And that has enabled us to, first of all, conduct a 50-state update on that matching service registries, plus, importantly, build out our understanding and our content on respite care specific registries as well. On the next slide, please. So recognizing that there is a proliferation of terms and definitions in play, we started by clarifying our focus. And real briefly, here's the inclusion criteria that we used. We were looking for registries that allow independent providers, so the workers, to post searchable profiles, and that may also, but not necessarily, allow consumers or family caregivers to post specific jobs as well. So either two-way searchability or one-way searchability. We were looking at registries that cover a range of home care services or that focus on respite care only. And we wanted to focus on registries that support publicly funded self-direction and or respite care programs. Although in some cases, those registries may also be available to agency employers and or private pay consumers for recruitment purposes as well. So on the next slide, the flip side of that is what we didn't or haven't included in our research are exclusively training registries like those CNA registries, which are more about verification of employability than about employment matching. We also didn't include registries that offer static lists of providers only or that require a third-party navigator. For example, you have to call up and have someone help find a provider for you. So in other words, we only looked at the registries that enable workers and consumers to directly engage with each other to some extent. And we also didn't cover private employment platforms such as care.com or mycnajobs.com, although I imagine there is opportunity for comparative learning and cross-pollination there as well. So on the next slide, using those criteria, this is how we conducted our 50-state update recently. We started with desk research, and then we conducted outreach and in-depth interviews with registry experts across the registries that we had identified. We summarized that information that we gathered into detailed entries on each of the registries that met our inclusion criteria for inclusion or for posting on the PHI website, which I'll show you in just a moment. And then we also have analyzed the data thematically to inform the drafting of a public-facing, more in-depth report, which is currently in progress. So here's what we find. If you go forward one more slide, please. Thank you. In summary, and again, stressing that this is according to the inclusion and exclusion criteria that we employed in this work, we identified and profiled 12 registry platforms operating in 16 states. including 6 matching service registries, 5 of which have a respite care option, and 6 respite care specific registries, including Wisconsin's registry that Lisa just walked us through. 4 of those registries operate across multiple states, including Karina, who we will hear about in a moment. 11 of the registries operate statewide, and 1 of them operates regionally within the state. On the next slide, these are some more cross-cutting features and functions that we identified. 6 of the registries enable both independent providers or workers and consumers or caregivers to create searchable posts, while the others allow the worker side to post searchable profiles only, and then consumers can search and find or connect proactively. 4 of the registries also allow agency employers to use the registry for recruitment purposes. 6 of the registries require users to register and create a profile before they're able to search, whereas 5 are open access, so you can just get on the site and start looking, and 1 varies depending on which state is using that platform. 3 of the registries require a background check, to our understanding. 8 of the registries require users to communicate outside the registry, so they find each other and then they connect outside of the registry. Others have functionality allowing for internal communication or allow both or either option. So this is a snapshot of the Matching Service Registries page on the PHI website with all of that updated data. And the second screenshot in the middle there is an example of how we structured the information for each registry that we've profiled. And you can navigate directly to that site using the QR code, or you can find it under the advocacy tab on the PHI website, which is phinational.org. So on the next slide, from all of this, here is a set of key considerations for building or strengthening a matching service registry or respite-specific registry or related platform in a given state. Because these registries have enormous potential value for simultaneously addressing direct care workforce pressures and unmet ongoing and respite care needs. But they're not an easy lift, and they're not without cost. So the more thoughtful and robust the approach, the more that effort and investment will pay off. So first of all, at the outset, it's important to clarify aims and objectives. Questions to raise here include, what problem or problems does this registry aim to solve? In all cases, the answer is probably something about the workforce and about service gaps. But more specifically, what gaps? Who is most impacted? Where should the focus be? And relatedly, what will success look like? What are we aiming to achieve with this registry? The more specific the aims and objectives, the more targeted the design can be and the more measurable its impact. And it's also important if you click, I hope there's another piece on this slide. Can you give one? Yeah, okay. It's also important, and all of these considerations are interrelated. It's important to consider the reach of the registry. So who will be eligible to use the registry and who might not be eligible to use it? What geography or programs and services will be covered by the registry? Answering these questions, again, will help clarify the scope of the undertaking and to think carefully and perhaps in a sequenced way about how it will be rolled out. On the next slide, financing, of course, is a central consideration and probably goes without saying, but it's critical to assess in advance, to the extent possible, what startup and ongoing costs will be entailed and what sources of funding may be leveraged to cover those costs through the Medicaid program, potentially through workforce development, philanthropic grants, maybe even user fees down the road for some users to support ongoing operations. A key step here might be to map out different approaches and their respective costs and trade-offs, like using an existing platform versus building a new one, or limiting the platform to respite care versus broadening it to include other programs and services, and so on. If you click one time, please, partnerships are also essential for informing driving, and sustaining successful platforms. And I think you will hear more about that from our state speakers this afternoon. So it's really important to think about which partners should be engaged from the outset and who else might need to be involved over time during different phases of design, implementation, evaluation, and so forth. In other words, who are all the players who will help ensure that this platform works the way it needs to work? On the next slide, of course, there's the technology itself, the design and development of the platform. How should the registry be designed to meet those articulated aims and objectives? And also, how will prospective users be engaged in the design process, and how will their input be incorporated? Because we certainly don't want to design a resource that won't be acceptable or useful to those that it's intended for. And what are the priority functions and accessibility features versus those that would be nice to have versus those that actually might turn out to be distracting or redundant? Some of the examples here are what communication tools might be included within the platform or not. What will be the searchability functions? How will we account for accessibility, security, and privacy? Should the registry be linked to other resources like an existing training registry? And of course, folding in here, what are the legal terms and conditions and safeguards that need to be managed and put in place per Lisa's guidance a little bit earlier? And then marketing also matters, of course, because we know that it's really never a case of build it and they will come. If you give one more click on this slide, the key question is here, how will the registry be promoted to different potential users? And I think Lisa has some great expertise about how they are pilot testing different marketing approaches to see what is most effective for reaching potential users, because the aim here has to be to reach that critical mass of users that's necessary for a registry to really succeed. That's a key consideration and line item in the budget as well. And then finally on the next slide, but also from the outset and all the way along, it's important to consider evaluation. What metrics will be collected through the registry? How will key data be tracked and monitored and reported over time? And how will that data be used to improve the registry as needed? Working through these questions is essential for ensuring that the state is positioned and prepared to evidence the implementation and hopefully the impact of the registry in order to make the case for sustained and perhaps expanded investment. I'm going to wrap up here. I included one last slide, which just pointed to the wonderful opportunity that we had as part of our broader program of research to conduct an independent evaluation of the Carina platform in Washington State. But with that, I'm actually really happy to hand over to the next speaker, B. Rector from the Washington State Department of Social and Health Services, who, as a side note, is one of my heroes in all of this work, who will bring a spotlight to the Carina Registry. Thank you.
Thank you so much, Keisha, and we certainly appreciate the longship with NASHB as well as PHI and others who help us in this important work. So we have had a worker registry in Washington State since 2006. Our original registry was developed by a private vendor, and a small state agency operated and maintained that registry. And that registry was used until 2018, when it was replaced by one that I'm going to talk about today, which is Carina, that Kezia also mentioned. The reason that we made this change was because it was extremely difficult to secure and maintain funding to make the necessary and routine improvements in the registry, do the marketing and all of the really important components to make it a meaningful program in the way that we had previously funded it. Next slide. So just very quickly, Home and Community Living Administration administers Medicaid benefits and long-term services and supports, respite, personal care, habilitation to about 115,000 individuals with disabilities of all ages, including older adults. We're an operating agency that works under a delegated agreement with our state's Medicaid, single Medicaid state agency. And over 90% of individuals in our Medicaid program are served in home and community-based settings under a number of state plan and waiver authorities. And these services really are intended to take a client-driven approach with the aim of keeping people in their own homes. The majority of our workforce is family members. You can see 72%. Next slide. So Kezia talked about aims and objectives of our caregiver registry, and ours is really to be able to match both ways. Clients being able to post jobs looking for caregivers, and caregivers also being able to look for clients who might need care. Although many of our clients, as I said, have family caregivers, roughly 30% do not, but they do want to self-direct an employee in their home. So a registry is really important to help them find potential workers that they can interview and ultimately select. It is also helpful for clients to have an access to a registry to find substitute workers when their regular family member or employee is out on vacation or illness. And we've also heard from our workforce something that Kezia mentioned as well, which is the variability of hours in-home care can be extremely difficult. And it results in a lot of turnover. And so wanting the workers to actually be able to find and maintain and stabilize their income. So what does success look like? Clients get their needs met without gaps in care. Caregivers get steady hours. Matches are successful, both in terms of the hard and soft skills and preferences. People are able to remain in their own homes, and hopefully there's a long rewarding relationship between the client and the person that they have found on the registry. Next slide. So Carina is our state's referral registry. It's easy to use. It's a website where care professionals can match with those seeking home care. There is no cost to the client or the caregiver using Carina. It's really focused in the self-directed market and again, permanent substitute or respite workers. The only workers listed in the registry are ones that have met our credentialing and qualification criteria and are ready to be hired. And so in our state, that does mean a background check and some minimum training requirements, and then they have to maintain a certification and ongoing continuing ed. Carina is currently available in 10 languages. We're super proud of that. We launched 8 languages last year, and we have an additional 2 languages coming online this year, and that makes this program accessible to a much broader range of our workforce and our clients. Next slide. When Carina was developed in 2016 and 2017, we applied some lessons learned from our previous registry experience and identified key partners who needed to be involved at the outset. And then many of those partners have remained engaged over time. I know there's a lot of information on this slide, but largely what I would say is it's the same groups that need to be engaged at the beginning and remain engaged over time. The difference is really defining what you want in a launch or a minimally viable product that meets your aims and goals. And then what changes over time can you make to begin to truly reflect the nice to haves, the preferences, better understand what's working and what's not working, and get to that supply demand. So we're talking about state agencies, the case managers who are working with clients, obviously clients and workers themselves. Many of our workers are represented by labor in our state, so labor partners, and then those trusted community-based organizations that can be really key in outreach and marketing. Research and evaluation is something that has been extremely important for us to understand. the outcomes, as well as the qualitative experiences of those using the platform. And then philanthropy is something we did not bring in at the outset, but certainly something that we have looked at in order to try and improve the product over time. Next slide. So this funding, the funding for us comes through a collective bargaining agreement in a cents per hour that we agree that the employer agrees to pay to Karina, who is operating the platform. So the cents per hour that has been funding Karina from the beginning ranges from about 2 cents per provided hour of respite or personal care to 4 cents, depending on the year. The very first year, it was $1.1 million. That gives you a sense of kind of the scope of number of hours that we provide in a given year through our self-directed program. And 1.5 million was used and capitalized in the development in those first 2 years. And then we had a full statewide launch of Karina in 2018. Today, there are 70 million hours that we provide through our self-directed program, and funding in fiscal year 25 was 2.2 million at 3 cents per provided hour. Next slide. This just gives you a sense of utilization. Utilization has steadily increased since launch, ranging from about 2,000 users in the beginning to almost 20,000 users in 2025. And we consider a user a worker or a consumer, and we count users more than one time based on how many jobs they actually go in, post, and or apply for. Over 40% of our registered users last logged in to search for care or work in calendar year 2025. So we think that's a pretty good utilization. And in the first week of 2026, we had about 4,000 users on the registry. Next slide. So Kezia also talked about those priority functions and features, and we really look at this as what is necessary for minimally viable product versus what are you able to do when you get to a mature product. So for example, enabling safe connection and demonstrating feasibility and usage might be what you do in a minimally viable product. But then in a mature product, you're going to improve match quality, you're going to go to scale, and you're going to gain some system insight. Another example, messaging, minimally viable product for us was in-platform messaging tied to a job or a profile. But a mature, where we are now, automated messaging, moderation and flagging, pushing and pulling information to interested users using flags, advisory prompts, and help, automated help functions. Next slide. So to date, there has been over 18,000 self-reported matches between caregivers and clients in Karina. IPs who have found more than one client or a client who has found more than one IP is counted individually. And a recent study showed that the median employment relationship between folks matched in our platform is between 12 and 15 months in duration. And we believe that the registry has supported about 16 million hours of care and support since its inception. Next slide. So here are some key points for consideration in terms of building and maintenance. Very important to honor the caregiver relationship, enable users to create personalized profiles, job postings, and connect with each other online before meeting virtually or in person. This leads and facilitates successful, long-lasting matches. Engaging all partners in the vision, really creating that buy-in, work within a network of knowledgeable partners who can help ensure the relevance, promotion, uptake, and ongoing improvement of the platform. proactively build the market to reach critical mass. This is like an ongoing issue. Consider both supply, which is the workforce, and demand, which is the client side of caregiving. They're both important to the equation when building and promoting a successful platform. Ground the matching service registry and broader systems change. Really developing a matching registry is only one component of a comprehensive strategy to address our home care workforce crisis. And lastly, evaluate, improve, and educate, put data collection and monitoring systems in place to assess success, make adjustments as needed, and build knowledge on the value of these registries. And just as a quick example for us, we have learned that families trying to find respite and workers being willing to connect with people who need respite has been a real challenge on our platform. So over this last year, we've done a pretty deep dive to better understand the barriers and challenges and are working on strategies and solutions to make more successful matching for that service. And with that, I am going to pass it to my colleague, Nancy.
Thanks, Bea, and thanks to NASHP and PHI for the opportunity to talk about the work that we're doing in North Dakota as it relates to worker registries. We are the State Unit on Aging in North Dakota. We also administer the Medicaid and state-funded home community-based services for older adults and adults with physical disability. And so our registry is specifically kind of geared for that particular population and the providers who provide care to them. So next slide. So in North Dakota, we actually have a state law that says we have to have some type of registry. And so we have to produce information that would be available about what providers are enrolled with North Dakota's Medicaid system and that would allow a public person to be able to go out and look at our website. So who's included in ours is our qualified service providers, which really are our in-home direct service provider agencies. We have about 238. And then 1,300 individual QSPs, and about 32% of those are paid live-in family members. Most of our services are self-directed, so about 54% of the people that we're serving knew their provider prior to them needing care. And so, but for those individuals who don't know, who they don't have a friend or family member to assist them, the registry is a really important piece of how they might go about accessing services. So in North Dakota, we also have a little bit higher population of older adults and adults with physical disabilities who live alone. And so that can also be another reason why we need to support them in helping to find a provider. So our registry has been around a long time. It's used by the public, so people can go out and search if they're privately looking to hire someone. It's also used by professionals when they're working with consumers. Our HCBS case managers use it. Our Aging and Disability Resource Link uses this when someone calls and asks about how do they go about finding a provider. They could help them with understanding how to search. They can actually search for them and then provide them a print-friendly list. And so that it's used that way. And it's used internally for us to manage our provider records and data. Next slide. So our worker registry, the way that we've had several iterations because we've had this state law for probably about 30 years. So it started out literally as paper that came from an Excel spreadsheet, and we would sort it and send it out and to an access database that had a front-facing portal that you could search, to now working within our registry with Direct Care Careers. And that is actually a platform that's a project of Advancing States that offers states, there's 4 of us that are using that, to a platform that would help us to do a connection between workers and employers. It can be used as a registry. It also has a learning management system. And so we've really designed our registry to be part of a broader system change that supports our providers and the individuals we serve along the way. And so we use this site right now as our host site for our worker registry. Next slide. So to search our registry is really quite simple. You can search by a provider, by the city, the zip code. how far away they might be from you, the county level. And then we have all of our services. So the type of services needed is a list of all of the services. So ours are not just about respite, but any service that is available to home and community-based service consumers in North Dakota would be listed here. And then people can, like I said, search publicly for someone who might, if they want to pay privately, they can, this public can search it as well. So you can also just browse all of the QSP agencies. So if people are interested and want to know who's enrolled to provide these types of services with the state, that's how, this is the site that you can use. So next slide. So one of the key features of a registry is to make sure that the information that's on it is correct and that it's up to date at all times. And so we knew that we wanted our provider enrollment system to integrate with our QSP worker registry. And so we have been, we kind of started designing them at the same time. So we were able to build them so that they connect through an interface. So it's fully integrated with our provider enrollment portal. We have real-time updates. So if you make a change to a provider in the enrollment portal, it'll be updated overnight to the worker registry. It has print-friendly search results, which may seem kind of old school, but originally we did not have those, and we had a lot of complaints. And so that was a big improvement to our system, was when people could make those search and make a list. We have automated nightly data exchanges between the both systems. We have provider updates in the enrollment portal that automatically populate the workers registry, and providers get to decide whether they want the information on it or not. So everyone on this site is enrolled with the state of North Dakota to be a home and community-based services provider. And so we have provider qualifications. We require them to go through all of the Medicaid required background screening. Some of them have an actual criminal background check. So it just depends on the service that that person wants. Next slide. So we funded this through originally our portal through the 9817 10% American Rescue Plan funds that the state's got. We purchased the Connect to Care or the Direct Care Career Portal with our Money Follows a Person capacity funds. And then we used Money Follows a Person rebalancing funds for ongoing maintenance and operation of the system. So we've really blended a lot of services and ultimately our rebalancing funds to continue to be able to provide this service in the future. And really, you know, what we're trying to do is make it very a simple process where a provider can go out, they can enroll, their information would go into the registry. The people who need that information to choose which provider they want can go out to the registry to do that. We're also going to connect it to our learning management system, which is also available in that direct care career platform, so that they can go out and they can take our required training, and a credential would show up on their profile, so that if I'm searching for someone, I want to maybe see if they have a dementia, do they have a dementia certification? Do they have TBI? Can they, you know, serve people with different needs? And so that's kind of the ultimate happy path for our systems. And so we're in the process of finalizing that, and we should have everything wrapped up by the end of May. And so I did also, I know Kenzie mentioned this as well, but there are potentially some matching funds available through the APD process. And so encouraging people to go and go out there and they can search for Medicaid funding. But I know that we're just 2 minutes before we need to close. So I'll turn it back over to you, Kimberly.
Wow, thank you all so much. A lot of great information in such a short period of time. So I know we only have about 1 or 2 minutes left for questions, and just so all attendees know, we have begun answering them in the Q&A feature, so you can check that out. And if you have anything additional, please feel free to add that in. Perfect, great. Well, I believe we answered all questions in the chat. Oh, one did come up. Yes, we can submit a Q&A FAQ of the questions and answers to the attendees as well. So you all have that. But with that, a big thank you to all the speakers, Nancy, B, Lisa, Tizia, and to the NASHB staff for supporting this webinar and hope you all have a great day. Thank you so much.